So it is disease of men and it is disease of elderly populations. So routinely, we don't advise for all population who are elderly who doesn't have any symptoms related to the prostate. So that means uh, the population who doesn't have any urinary complaints, we routinely doesn't recommend to go ahead like for screening test because of the overdiagnosis. So there are trials which were conducted just to see uh, the screening benefit which can happen with the prostate cancer. So it has been found that because of this type of screening, uh, there was overdiagnosis in the prostate cancer. Unnecessarily, the patients or the general population, they have to undergo like many type of the imaging. So they have to undergo like imagings, sometimes biopsies, which are very much unnecessarily. And so, like in doing this type of the procedure, so the mortality had also happened in those trials. So routinely, we are not recommending maybe the patients who doesn't have like symptomatic prostate. We doesn't recommend for any screening test in those individuals. So the individuals who do have urinary complaints, they should go and do their screening for the prostatic malignancies, and whether it is found suspected to be having some like malignant disease, then only biopsy from the prostatic gland should be considered. And with this, we will be sometimes able to diagnose prostatic malignancy very early, where we will be able to uh, give total cure with the surgery or sometimes with the uh, like radiation therapy.
Right.
See, basically, prostatic cancer are like slowly growing malignancy, and some of the patients, those with the low risk or very low risk, can uh, live like more than 5 years with cancer itself. So those who are having high risk disease, the survival with the treatment can go beyond like 2 years.